Dr. Burstein, welcome to AM Buffalo. Thanks for joining us in the Zoom.
Sure, Happy New Year.
There is one thing that we can take charge of for 2021. That's our health, and you're a little bit of an expert on that.
Thank you. I'd like to think so. So we want to start off the new year, 2021, on the right foot and be healthy. So we know that in 2020, like a lot of our regular health routines were challenged and we weren't able to stick to a lot of the practices that we usually do to keep ourselves healthy. So it's 2021 now and we have COVID vaccine out and we know that we can see a light at the end of the tunnel. So no more excuses. We have to get down to it and be serious about keeping up our health. So there are different things that we should think about doing for different stages of life. So for kids, we know it's really important that parents continue to take their kids to their pediatricians. We know that pediatricians' offices have worked very, very hard to make their offices very safe. Young kids really need to be seen pretty regularly for, first of all, for their vaccines. And there's other screenings that are equally important. So developmental screenings, just to make sure that your kids are on track. Because if they're not developmentally, and this is actually, very common, your kids could be eligible for early intervention services that are free. Also for mental health screenings, we know that kids, just like adults, get really stressed out. I mean, there is no stupid questions. When I had my kids were young, I used to call my pediatrician's office all the time, like, "Hi, this is Dr. Burstein with a stupid baby question." And because, it's different when you're the parent. I never wanted to be Dr. Mom. So, well, childcare will make sure, taking those regular visits will make sure that your kids, stay healthy and nothing falls through the cracks. So adults also need to keep up with their preventive healthcare visits. Just because you've turned 18 doesn't mean you're free and clear. So we know that there are screenings that should be done to promote heart health, and making sure that everybody's up to date with their immunizations. Adults need immunizations too. In addition to flu, there's the shingles vaccine, there's the HPV vaccine, and those are all really important immunizations that can prevent very serious diseases.
And then how about for seniors?
With seniors, we have to do screenings for safety. Making sure that their house is foolproof to protect them against falls. Also screening for memory issues. During the golden years, unfortunately, many people develop memory problems and dementia. So they're good screening tools for that. Of course, with primary care for immunizations and for a checkup, you need to be there physically, but a lot of problems can be managed by telehealth. People have to just, figure out how to, manage their health care in this new world of COVID-19. We do have a vaccine, but the general population is probably not going to be able to get immunized for a month. So COVID-19 is still going to be with us for much of this year. And so we have to make sure that we figure out how to stay healthy throughout the year.
If 2020 showed us that nothing's certain, one thing is for certain: we can take charge of our health.
And we can stay healthy throughout 2021 in this new year.